very pleased to introduce Dr. Kim, who's our chair of physical medicine and rehabilitation medicine here at UT Southwestern. Dr. Kim came to us via Columbia. Before that was at CHOP, did her original training in Seoul, South Korea, and is one of the eminent international experts in spasticity management, primarily as it relates to cerebral palsy. And she made me promise to say I'd put the disclaimer that her focus has not historically been immune-mediated spinal cord disorders. But number one, after this conference, we hope to convince her to shift gears and focus on immune-mediated spinal cord disorders. And number two, there's a ton of overlap between the questions that come up from all of our patients about spasticity management, whether we use pharmacologic or interventional means, and Dr. Kim is a world expert on that. So I thought we'd take 10 or 15 minutes for some comments and questions for Dr. Kim, and then we'll move back to the program as is. So Dr. Kim, thank you.
Thank you. Hi, everybody. I am so sorry that I was late, and I think Dr. Greenberg should give me a little bit of credit that I am also very good with the spinal cord dysfunction. I didn't tell him that, but I am. So I was actually invited almost like a last minute because I had a patient who has transverse myelitis when I was a young faculty, and I was doubting that the patient doesn't look like a transverse myelitis patient for me, although neurologist insisted that the patient has transverse myelitis. So I had to repeat the MRI. I did an EMG. Then actually it was anterior horn cell disease. It was different, low motor neuron disease. And then my patient's mother is here. So they invited me to get to know us. But as Dr. Greenberg said, my life is all about the cerebral palsy and childhood onset disorder, which is spina bifida, spinal cord injury. So I deal with a lot of muscle stiffness. So if you guys have any questions, I can answer to you, or I can just talk about it. So anybody has a question on spinal cord injury or muscle stiffness or using the baclofen, intrathecal baclofen pump kind of stuff. I know, thanks for bringing arm, please. I like to have a couple of questions since I drove here.
So our granddaughter, she's 8, and we're at our last appointment. They told us that she's beginning to have some scoliosis. And is that related to spinal spasms?
I missed the person. She started to have what?
Scoliosis.
Scoliosis, yes.
So is that related to, she has transverse myelitis, but is that related to spasticity? Is that why she's developing that? Is that
so? Does she have trouble with the whole body or?
Yeah, about thoracic level.
Thoracic level, yes or no, because the patient who has spasticity, they also have weakness, right?
Yes.
So combination of muscle stiffness and weakness is going to cause muscle imbalance. So that can be possibly cause for the scoliosis, which means we call the neuromuscular scoliosis rather than idiopathic scoliosis. So some cases I treated with botulinum toxin to delay scoliotic curve. Some cases I was able to successfully delay for a while, but neuromuscular scoliosis is a little tricky because we still do not know how we can prevent, but years of experience is that at least during upright position, I like to apply the brace. And that really delays because it's muscle imbalance. So still we can hold it. There's a fixed curve and flexible curve. Still, some curve is not fixed yet. But if you sit with the same position for a long time, it can be fixed easily. So even the orthopedic may not agree with me that they said neuromuscular disorder, scoliosis is not going to be prevented with the spinal jacket, body jacket. Usually we use plastic, but I witnessed that quite a number of patients didn't develop severe scoliosis for a long time. But also, even though it's not related to their growth, But we are dealing with the pediatric population. The children, the difference is they're getting taller and longer. So if they have a spasticity, the bone has no spasticity, but muscle has spasticity, right? So whenever they grow fast, they have a huge imbalance between bone and muscle growth, which could cause the imbalance in the muscle length. So can be the cause for the scoliosis too. Not the evidence-based yet. Any other questions? And but maybe yes, please.
But I was attacked by a dog last fall, and I seem to have that spasticity seem to get worse. So I'm on baclofen now, but I can't really tell that it's doing any good.
So supposedly your lesion is in spinal cord area,
It's a
right?
thoracic, yeah, T9 and T10.
Right. So just with my experience, because I usually do not recommend the botulinum toxin injection to spinal cord injury patient, it's less effective than baclofen.
Baclofen?
Baclofen is much more effective for the patient with a spinal cord injury because when we think about the receptor of the GABA, which is in the more spinal cord, relatively. So when I use the oral baclofen, it's much effective than botulinum toxin injections.
I do gabapentin and baclofen.
Okay, so but
But-
you don't feel that baclofen is not working.
No. Mm-mm.
Then why you said it's not working? Your stiffness is the same?
Yeah.
Do you have a pain anywhere? Anything is bothering you?
Pain on my right side. Yeah.
If you have a pain,
Or pain, I think it's pain from the spasticity.
so there are two different things, right? So it can be either way.
Okay.
So if you have a pain can aggravate spasticity.
Okay.
And then spasticity is going to cause pain. So you
Okay.
may be in
So it's a
vicious
circle.
cycle. So in that case, you can try, how much dose are you taking? Oral baclofen?
20 milligrams a day.
That's very low dose.
Mhm.
So you can go up to 80 milligrams. Sometimes the PMNR we use like up to
I
very
think the-
high dose. So
The
you can
fatigue is what I was,
fatigue.
well, the fatigue is what I was worried about.
Also, do you have fatigue from the baclofen?
I think, yes, I think
Then
so.
I think
So,
Then I think we can try. But could you tell me a little bit about
well,
your?
I'm also a caregiver too, so I
Okay.
can't get fatigued. I mean,
Why not?
I need, so I've been fighting this, trying to get a dose
Understand.
that I can compromise
Right.
on.
But can I ask you what kind of pain do you have? Where is your pain and what kind of pain do you have?
It's in my abdominal area all the way down to my feet.
Is it like kind of pins and needle or just
Yeah.
achy?
All of it. Yeah.
Is the Dr. Green? Are you Dr. Greenberg patient?
I'm Dr. Tardo's patient. But the thing is, I wasn't on baclofen. Sorry. I mean,
I know I work at
I wasn't on baclofen until I got attacked by a dog. And it just seemed to just like, I'm sure my nerves and just, I was a mess.
I don't know. Sometimes
So
I use botulinum toxin for neuropathic pain if that is a kind of nerve pain.
mhm.
Pins and needle kind of pain. Sometimes I follow the pain area with the botulinum toxin. Because of your fatigue, we don't want to increase the medication by
Yeah.
mouth, right? Because
Yes.
it makes you drowsy.
Yes.
So if there is a neuropathic type of pain, I usually do use botulinum toxin to the area where you have that kind of a pins and needle type of pain. It can be, and then if you want to give a very low of baclofen, then you have to think about the intrathecal baclofen trial. That can be, because it's 1/100th of oral dose we can use to be as effective as like an oral dose. So I don't know. Is that answer to you? Your questions? But we can talk a little later. Yeah. Yes.
Well, I've got animal, and then I get this pain on my feet specifically, and it's from time to time, and mostly in the evening at night, and it comes and goes. It's not every single time. It's like maybe like once or twice a week. And my question is that when do you know when it's time to actually start taking medication for it? Because when it comes, I really can't even sleep. I just have to like, just
That's
With
very,
the
to
pain.
me, philosophical questions, right? Because I'm not the fortune teller, so I don't know when you have to take the medication, but if you can, we usually as a physician, we can make a joke, but you can do diary, right? You can write down your pain pattern, the time and pattern of the pain, then we can review that one. And then we can even think about what time you have to take the medication in regular basis. So for now, I cannot answer, but you should have a write down every day what time you're having pain, what causes
And
your
how long
pain.
it
Those things
lasts
is
and
going to
all
give
that.
us an idea how we can tell you what to do.
what to do. Okay.
May not, but hopefully. Any other questions I can answer? Because I know you guys have to push this process. Thank you so much for having me, and please, I can answer if you have any questions. Thank you.